Your body is always talking to you. What happens when it lies? Interoception is your body's internal sensing system. Hunger, fullness, heart rate, temperature, gut signals, and the felt experience of emotions. Humans have between 22 and 33 distinct senses. Interoception is one of the most critical, and it's the one that eating disorders destroy. Eating disorders have the highest mortality rate of any mental illnesses, and every type restriction, binging, purging, and compulsive exercise distorts interoception through the same mechanism. Dr. Jennifer Gaudiani calls it the cave person brain. It's the ancient survival system that rewires your body's signals to keep you alive. Your body speaks, but the illness translates. You feel full after 3 bites. That's gastroparesis. Your gut paralyzed from starvation. You feel fine on 800 calories. That's cortisol masking starvation while the body self cannibalizes to keep labs looking normal. You feel like you ate too much after a normal meal. That's a post meal autonomic surge, not reality. You feel driven to exercise. That's cortisol driven restlessness wearing an exercise costume. Every one of these is a documented clinical phenomenon, and every one of them feels completely real to the patient. Dr. Gaudiani calls these the unmeasurables, real physical complications that modern medicine can't easily see. Patients suffer, labs come back normal, and the eating disorder says, see, you're fine. Recovery programs say listen to your body, but the body has become an unreliable narrative. And right now, there are zero tools that detect this distortion in real time. Patient sees their therapist for 1 hour a week. The other 167 hours, the cave person operates unchecked. This is Intercept, a speculative interoceptive surface for ED recovery, all bodies, all types, and one interval. A peacock feather shaped shoulder patch. The eye of the feather is the sensor node. It reads heart rate variability, skin temperature, and autonomic markers to detect hibernation mode. It sits on the shoulder like an ornament, not a medical device. We designed it for anyone in ED recovery working with a care team, teens, adults across every diagnosis. The wellness goal is rebuilding interoceptive accuracy, teaching the body and brain to trust each other again.
Intercept does exactly two things. Warm, when the cave person brain is quiet and signals are trustworthy, the feather is gently warm. I'm here, you're okay, and a tap. One gentle press on the shoulder when the hibernation mode activates. What you're feeling right now is not the whole story. Two outputs, nothing else. Every additional feature is a sentence the eating disorder can finish. The companion app speaks only in cave person brain language. Here's how it works in everyday life. Use case 1. It's lunchtime. A patient eats 3 bites and feels completely full. The patch detects gastroparesis markers and taps the app shows. This is hibernation mode, not reality. The patient shares this with their dietitian. Use case 2. It's 2 a.m. A patient feels the urge to exercise. The patch reads cortisol driven restlessness and taps the app, says your cave person brain is running the show. She screenshots it for a Thursday therapy session. Use case 3, a patient has a quiet week. The timeline shows 5 days of trustworthy signals she sees for the first time that her body is coming back online. No numbers, no scores, no streaks, just your cave person brain activated less often this week. This is our live demo. Once the user enters the app, there's a care person mode and a patient mode. Once a patient enters the app, this is the normal mode where they're not feeling any levels of stress or urges for their eating disorder. But the moment they feel something, the patch activates and they go to this um, active mode, and then they can either say they understand or they can go to tell me more, where they can see what just happened and why that matters. They can also access the timeline to keep track of how they've been feeling this entire time, and they can go to settings to adjust the patch sensitivity and also access multiple resources on eating disorders.
Our core design principle Intercept never gives the eating disorder a sentence it can finish. We never say hungry, full, or any body specific language because the illness weaponizes it. No calories, weight, or food tracking. No scores to optimize, no streaks to chase because perfectionism is a core eating disorder trait. A care team code is required to activate. Intercept is not a standalone product. It is a clinical companion positioned within a treatment team, therapist, dietitian, and physician. It is closer to a hearing aid than a Fitbit. For the ones in eating disorder recovery, the hardest part isn't the diagnosis, it's that their own body is lying to them and no tool exists to show them when. Until now. What you're feeling right now is not the whole story, and the movement you need is on your shoulder. Thank you.